Hello, my name is Tisa Fola and I work with African Center for Treatment and Rehabilitation of Torture Victims as a social work coordinator with the organization here in Uganda.
Welcome all. My name is Abubakar Barusi Juma.
Hi, I'm Mariam and I'm a fundraising assistant at the Treatment and Rehabilitation Center for Victims of Torture in Palestine.
Today, I'd like to present to you a very short video with regards to our staff safety and care in relation to IRCT Global Rehabilitation Standards, which came into effect a year ago.
I wish to speak about paragraph 11 that speaks of staff safety. What do we understand by staff safety?
Staff safety refers to the provision of a safe and secure work environment and safe procedures in the workplace in order to ensure employees' health and safety.
In performing our duties as health professionals and advocates, we consider the environment we work with. We are often put at great risk for speaking out the truth and for rendering our services to victims and their families. We are not spared from reprisal and intimidation. By standing against possible government abuses, we are sometimes placed into a dilemma between accepting medical complacency and becoming a truth teller.
And you know that we are working in a setting and conditions that keep the staff really fragile in some situation. Dealing with the stories of victims of torture and the suffering of the victims as psychologists or any other mental health or health professionals will put on you, will also affect you. And you will be, as professional, part of the story of the victim.
Every organization has a moral obligation to guarantee the safety of its employees. Here at the Treatment and Rehabilitation Center, senior management prevents discrimination, harassment, and sexual abuse by regularly providing anti-discrimination training to all employees, raising awareness of the complaint system in place, mostly through email, to report any discriminatory, harassment, or abusive behavior, and frequently having one-to-one catch-ups with employees to ensure they are not enduring mental and physical fatigue.
We had to develop and implement programs based on safety and care for our staffs in tandem with IRCT Global Rehabilitation Standards, so that our staffs can be able to offer quality, effective, and efficient services to the victims and survivors of torture.
We are committed to promoting, creating, and maintaining a safe organizational culture for employees and all individuals working with us. This includes our partners and all communities we work in. We have put in place safeguarding policies to help prevent and respond to abusive behavior, including child abuse, such as the Code of Conduct and Code of Ethics for our psychologists and social workers. We also ensure a high level of oversight and accountability around our protection efforts by monitoring and reviewing our protection performance and seeking feedback from all employees and beneficiaries of our programs regarding the effectiveness of our protection measures.
You know that at Restart in my organizations, based on this standard, we develop a policy to allow a complaint system to allow our staff to be protected and to have the right to complain, to be secure, and to respond to the threatening that could affect them through their practices.
We have already developed a written policy on safety, health, and working conditions for our staffs, protection in the office. We have also developed standards, guidelines, and codes of practice on occupational health and safety for all our staffs in the organization.
Our social workers perform their work in line with the appropriate methods and are not sent to environments that make them feel unsafe or limit their ability to perform their work in line with proper safety procedures. Social workers are able to report safety issues such as harassment and bullying safely and confidentially and without fear of retaliation.
By we have established a blame-free and just working culture through open communications supported by legal and administrative protection from punitive action when reporting adverse safety events.
One, with physical security, of course, the organization has to ensure that the working environment of the staff is conducive. They have safe space where they can offer their services. They have the guards at office that watches over maybe the CCTV cameras that can be also put so that staffs are ensured of their own safety.
As a human rights defender, our lives are always on the line. The Medical Action Group have been advocating for greater protection of human rights defenders, especially those in the medical sector. We have been promoting ethical as well as operational standards in addressing cases of human rights violation, as we are committed to work independently and transparently.
And also, still under physical, we have field visits. When we go out to the fields, we have to ensure that we scan the environment, the security of the environment that the staff are going to. For example, we have locations that we still term as unreachable because of the conflicts or the violence that is going on. So you cannot just send out your team. You have to do a scan, the environment security scan. How is it? Is it safe for your staff to go there? How about the vehicle that they're going to use? Is it safe for them to use that vehicle? And if it's not, then which other means can you use that the staff can feel secure and protected to go out to the field? And when we go out to the field, what we say out there, we are very, very sensitive on it. Why? Because SCTV, we have the non-confrontational approach. We have to be very objective because we understand the environment that we are working with. We understand the sensitivity of the cases that we are working with. So even us as the staff, we have to be very sensitive whom we talk to, what we say out there, to who, and in what context, so that we are also protected. And as we reach out to the field, we also report our presence in the various community, to the various community leaders, and let them know that we are here and we are here to do ABCD for this number of days. That is also part of our security, our safety.
We have assured our staff of access to psychological support and are able to report safety concerns without fear of retaliation.
As a health organization, we are aware that certain health and security protocols and procedures should be followed in performing our tasks as we seek support and protection for all of us who work for human rights. MAG has already taken steps to institute programs to care for the carers and to promote health and security mindfulness to our clients, partners, and networks to effectively continue our work in service to humanity.
And also SCTV has a staff focal point security person in office where the staff can reach out to in case of any security threats.
For this reason, a system in place is very crucial, and to abide by this standard is a priority.
Thank you.